It's my feel-good breakfast show.
Welcome back. You're still live with your Feel Good Breakfast Show. It is the month of June, and the month of June commemorates World Infertility Awareness Month. Infertility affects millions of couples, and it is not only a condition that affects women, but men are affected too.
That's right, and we all hope, not all hope is lost for those who are dealing with infertility. There are a number of advanced fertility treatments available today. Now, Reproductive Medicine Specialist, Dr. Lizle Oosthuizen, she is here to tell us more about World Infertility Awareness Month and, of course, the options that are available for couples that are struggling to fall pregnant. Good morning and welcome to Expresso.
Thanks so much for having me.
Let's start right at the beginning. I think this is a topic that sometimes it puts a lot of pressure on the women more often, but how does one define infertility, not just in women, but in males as well?
So when we're talking about infertility, we should really look at the couple, because this is not just a woman or a man's problem. So we should be defining what's happening when a couple is trying to conceive. So if we are looking, and we have to take age into account, under 35, if you've been trying to conceive for a year, then we would say you should fall into the category of being investigated for infertility. Over the age of 35, as a woman, you should also be coming for assessment when you've been trying to conceive for 6 months. Because as you get older, egg quality decreases. We don't want to push it too long. When you're 40 or in your 40s, that's when you should really be making quite a concerted effort to go and see a specialist if you are not falling pregnant, because time is of the essence. When it comes to diagnosing it from a male or female point of view, that's where we have to start doing assessments, and we have to start considering from a male point of view the semen analysis and doing a workup from that side.
I have quite a few friends who are struggling to fall pregnant or have had to go to alternative measures to, to make sure that's the process that happens. How common is infertility within couples?
It is incredibly common. So worldwide, they're saying between about 8 and 12%, but we know it's realistically more like 1 in 6 couples. In certain parts of Africa, it can be 1 in 4 couples. So it is incredibly common. I always say to my patients, look at the busy waiting room. Look, the next time you're in traffic, look at the cars around you. If you can see another 6 cars around you, likely one of those people is being affected by infertility. So it is common, and we should be talking about it, but we don't.
We don't. You spoke about the age, because I think also as women, there's always a biological time clock. People always say you need to get it done, sooner rather than later. But is there a right time to start falling pregnant, or how does age really factor into your infertility?
Well, the right time to be falling pregnant, unfortunately, is in your 20s. So that's when our egg quality and our egg number is really the best. But with today's society, with everything that women have achieved, we're focusing on our careers, on not settling for the partner we don't want to have a family with. And sometimes it might take a little bit longer to start trying to fall pregnant. So age really does come into effect, because we are born as women with every single egg that we are ever going to have, and we are losing them, excuse me, we are losing them from the time we are born. This slowly happens until we hit menopause. However, in our 30s, we start decreasing our egg quality as well as our egg number, and in our late 30s, this starts to rapidly decline. So by the time we are 40, we really are in trouble with both egg number and egg quality.
I love, Lizle, how you were mentioning, for couples under the age of 35 who've been trying for a year and haven't fallen pregnant, and then there's the time period for if you're over 35 and 6 months. What else should couples be looking out for? Are there any telltale signs or symptoms that they might have to address? Hang on, maybe we fall in that infertility bracket and we might need to see someone.
Well, the first thing is, when we are talking about trying to fall pregnant, I often hear patients tell me, we've been trying for a couple of months. But when you ask how long have you been having unprotected intercourse, then that's actually a lot longer. So you need to look at the entire time frame in which you could have fallen pregnant. From the woman's point of view, we always have to look at her medical background, because if you are known to have endometriosis, polycystic ovarian syndrome, if your periods are irregular, if you have severe period pain, or there's anything else in your family history where you think, hold on, a couple of people struggled in my family, or there've been a lot of miscarriages in my family, you might want to get assessed sooner. From the male point of view, things that make me concerned are a history of testosterone or steroid abuse. If a male has problems with erectile dysfunction, for example, and we just need to look at his overall health. So diabetes, other medical conditions, and just general lifestyle can also impact on that.
I find a lot of couples don't discuss this, and when it comes to that time, it actually puts a lot of strain on the relationship because no one thinks it is a possibility that they can fall within that category. Well, Dr. Lizle Oosthuizen's not going anywhere. She's going to be here as we continue to talk and really commemorate World Infertility Awareness Month, which is this month, the month of June. So if you have any comments or questions, please head on over to our social media pages and don't forget that hashtag Expresso Show.
It's my feel-good breakfast show.
Welcome back. Thank you so much for joining us as we continue to delve into World Infertility Awareness Month, which is commemorated over the month of June. And we have Reproductive Medicine Specialist, Dr. Lizle Oosthuizen, joining us. Thank you so much. Really interesting, opening to the discussion. I'm glad that I got to actually weigh in because I think there is a stigma attached that this is very much resting on the woman's biology, and regardless of whether it sits with a man or the woman, it's a couple-driven conversation. So we're going to have that conversation and continue it right now.
I want to
Go for it. I know you.
We spoke about age, being a factor in this, but what other things, come in play when we look at infertility?
So we have to look at your general lifestyle. And obviously people know a lot about pregnancy: don't drink, don't smoke, follow a good diet, get some exercise. But we also have to consider that even though we're pushing falling pregnant later as a couple, our lifestyles have changed and the way we live in the world has changed. One of the things we need to remember is you need to keep your weight at a healthy level. You need to be getting some exercise. You need to have a well-balanced diet. You need to not be smoking. And also, just from the male point of view, you need to stay away from all the steroids in the gym so that doesn't actually affect what's going on with sperm. Weight can affect sperm. Smoking can affect sperm. Now that marijuana is legal, that also affects sperm. So we have to make sure that we're keeping a very healthy lifestyle when we are trying to fall pregnant.
Unfortunately, we know this in so many areas of our health. We know that staying generally healthy is the key, and yet we find it very difficult to maintain that. And we often look back in retrospect. We want to now correct things. Let's wipe the slate clean and say we are a couple now that is dealing with infertility. What treatment options are available? Where do we start?
So the starting point should always be coming to see a reproductive medicine specialist. A lot of people want to go to their GP, or you want to go to your gynae, because going to see a fertility specialist has that stigma of, okay, now I'm admitting there's a problem, and that's a really scary and anxiety-provoking thing. So coming to see the right people so you don't delay the right treatment is the first step. So I like to see both patients. If you are in a couple, whether it's heterosexual or homosexual, you should come in and see us, and we like to assess both of you and see what your options are. We always start with a full examination. Female partner, for the male partner, we often do some blood tests. We do a semen analysis to see where the issues are. And based on what we think the diagnosis is, we will then recommend treatment. There's a huge array of treatment that we can offer, from simply helping someone who does not ovulate to ovulate. We can work on certain factors if there's a problem in the sperm count, or we can get around certain issues by different treatment modalities. If there are issues with the tubes, for example, we might want to recommend IVF or surgery, and a lot of the time we might need to operate, either for a diagnosis or to find endometriosis and treat that.
Can I just add a question to this, because I've known many couples and individuals who have dealt with this, and I know that every story is completely unique. Have we moved forward from where we were 5 years ago? If someone went through this process, because I know that attached to it is a huge emotional blow if it doesn't work, if the chosen treatment isn't successful. Have we moved forward? Should someone who tried 10 years ago try again now? Where do we stand now in terms of where the medicine is at the moment?
Well, we have made a lot of advances. What we can't do, and what we will never be able to do where we are currently, is make more eggs when there aren't eggs and to improve egg quality. So that's something we can't do. We're hoping to work on it. There's a lot of research coming out about stem cell therapy, PRP, that sort of thing, but we're not there yet. So technology has advanced. We have far better incubators when we're doing IVF. We have more information about doing genetic testing to make IVF cycles more successful. And the actual medication process has become a lot easier with fewer injections, far fewer side effects. Old IVF from years ago has a terrible reputation where people think you're hormonal and moody and you're an absolute psychopath while you're on medication. Sure. And that's really not the case. Most of my patients are really surprised when they come in halfway through their cycle and they say, I'm not really feeling anything other than bloating. So the medication really has advanced, and we've made it a lot safer for our patients, especially in an era of COVID where we've had to adapt everything for COVID-19.
It's really good to hear.
World Infertility Awareness Month is happening now in the month of June. We're still answering all of your questions, so hit us up on our social media, Expresso Morning Show, SABC3. Dr. Lizle Oosthuizen is still here to answer all of your questions.
It's my feel-good breakfast show.
It is your Feel Good Breakfast Show, and we are continuing with our health discussion this morning. Reproductive Medicine Specialist Dr. Lizle Oosthuizen is still with us, and she's ready to answer all of your questions on infertility. Thank you once again to every individual who has sent through their questions with us this morning. And we do have some of those comments that came through for us this morning. Let's take a look at it. The first one is from Lee Marie Ackerman. She says, my husband and I are married for 5 years and we have been trying for a baby since we got married. We are in our mid-30s. What can we do?
So the first step, I would say, is come and see a fertility specialist. Whenever you've got a long duration of trying to fall pregnant, and that's usually in my mind sort of 3 to 5 years, I start worrying about either the sperm function or the tubes. So we do actually need to check that, check egg number, have an assessment of egg quality, although mid-30s usually egg quality is still good enough. But you need to start off with finding what the actual problem is.
I'm going to ask you a very important question because in my first-hand experience, well, kind of second-hand, but first-hand experience of this journey, and it is a journey because it can encompass a person's adult life, the emotional toll. What are the emotional implications for an individual and for a couple in your experience in this space?
It has a huge emotional impact from trying to understand the fact that you have infertility, because we always see it as someone else's problem, or we internalize it as there's something wrong with me, instead of saying this is actually a medical disease, and it's recognized by the WHO as a medical disease. So from admitting that there is a problem and embarking on that journey of treatment, and I'm so glad you brought up that it is a journey, because it really is. We start at point A, and sometimes that journey twists and turns, and we find ourselves in a completely different point from where we started. But it takes a huge toll, both on yourself as an individual as well as a couple, and it can affect your relationship. We do have many psychiatrists, psychologists that we work with and we refer our couples to, because you do need that extra emotional support through it.
Board, yeah.
You do need that support from your doctor, but your doctor is not there at home when it's just the two of you talking about another failed treatment, or the fear about what if this doesn't work, or what if this does work and we have another miscarriage. So you need to have that emotional system built up around you. And because couples don't talk to their family or their friends about this, it's often just that couple dealing with it themselves. And you're trying to be strong for yourself, you're trying to be strong for your partner, but you really actually need that extra emotional support around you.
It's real.
Where
It's
can
real,
people
really.
connect with you? Because I know there's still so many people out there that have so many questions about egg freezing as well. Where can people connect with you?
So I'm based at Cape Fertility, and if you want to get a hold of any of our doctors, we are 4 reproductive medicine specialists at our practice. They can get a hold of us either on our website, www.capefertility.co.za, or they can email us directly at info@capefertility.co.za. We are also on Facebook and on Instagram.
Thank you so much. You were definitely the right person for us to bring in this morning. Hopefully you found that as informative as we have. It is a medical condition. You are not broken. There are options available, but you need to learn more. So speak to a specialist if you think you fall into this bracket. And yeah, thank you once again for a really, really enriching chat. Thanks.